Okay, we're recording.
Okay, good morning, everybody. This week I'll be your group leader, and we're going to be going over the assignment in Lesson 8, which is the health belief model. And according to the directions, the first thing that we need to do is discuss and review the model. It's the final PowerPoint presentation in the assignment. Did everybody print it out, or can you see it?
Yes.
Yeah.
Do you guys just want to go through?
Is the assignment, is that the instructions or Alliance instructions?
It's what we're supposed to go over is this, right? It's the last PowerPoint presentation. It's in. I think it's in the relevance instructions.
Okay, is it called the health belief model?
It is.
Okay, yeah, I have that then.
Okay. So why don't I'll just go through like the first two slides, and then we can like take turns going through it, or is that all right?
Yeah. So just read it, right?
Yeah, let's just read it.
Okay, cool.
The first slide is the health belief model, and it says health seeking and other health behaviors is thought to be motivated by 4 factors, which is perceived susceptibility, perceived severity, perceived benefits of an action, perceived barriers to taking that action. And then later 2 more components were added, which is cues to action and self-effacing. I can't say the word. The constructs are perceived susceptibility, which is the degree to which a person feels at risk for a health problem. Perceived severity is the seriousness of contracting an illness or leaving it untreated. Perceived benefits, the positive outcomes a person believes will result from the action. Perceived barriers, the negative outcome a person believes will result from the action. Cues to action is an external event that motivates a person to act. And self-efficacia, how do you guys say that word?
I say it's
Do you know? Efficacy, a person's belief in his or her ability to take actions. Should have had my husband tell me how to say that word. Justin, do you want to read the next couple of pages?
Sure. Constructs, perceived susceptibility. We didn't read this, right? We're on number 2.
No,
right?
it's we're on the 3rd slide, which says it's based on K. Lewin's decision-making model.
Okay. Based on K. Lewin's decision-making model, goal-oriented or directed valence, how bad you want the goal, or subjective probability, likelihood of achieving the goal based on some action. Perception is the basis of all behavior. That is, people must believe they are susceptible to a condition or they will not act. The health belief model, or HBM, is known as a value expectancy model. The assumption that people will engage in healthy behavior if 1, they value the outcome being healthy related to the behavior, or 2, they think that the behavior is likely to result in that outcome.
Okay. Cassie, do you want to read the next 2 slides?
Yeah. The health belief model in action. Suppose you are concerned about a group of serious urban blues musicians who were heavy smokers, and you wanted to encourage them to quit smoking. You set out to conduct a health promotion campaign using the HBM and begin developing informational material sites for the 6 yes. And then the HPM in action. 1, you develop some brochures and internet materials that contain very clear information about the risks and the severity of lung, throat, and other cancers, as well as emphysema caused by smoking. You even throw in a few graphs and pictures. Okay, so you've hit on the first two. I have my retainer installed. I just rolled out of bed.
Fernanda, do you want to read the next two?
Okay, I see the slide number 7 or 8.
It's the one that says HBM in action number 2.
Okay, number 8 then?
It's number
It's-
7.
7, right?
It says you put some flyers, you put together some flyers, posters.
Got it. Thank you. The HBM in action. You put together some flyers, posters, web ads, and radio spots advertising a number of quit smoking programs and products that are relatively inexpensive or covered by insurance, and promise that clients will be smoke-free in a month. So you're trying to show the cost of quitting are low. Then in the same flyers, posters, and ads, you include testimonials from people who've quit and who are ever so happy about their new healthy state of being. You include those because we're trying to show the benefits are great. 4 constructs down, 2 to go. Number 3, the HBM in action, step 3. So now you need to cue to action. What will you use? Luckily, you find out about a famous musician who recently died of cancer because of smoking. You somehow are able to get some quotes from his wife saying if only he had quit, and so on. You put the information in blues clubs and music stores. Figuring it out to inspire some action. Now you just have 1 construct to go.
Okay, Casey, do you want to read the next 2?
Yeah. The HBM in action. For self-efficacy, you put together a brief steps to quitting booklet entitled 1, 2, 3, quit, congratulating yourself on the music-related title. Then you send out some trained quit coaches to provide a free starter demonstration at local YMCAs and at the meeting of the local musicians union. Got all the constructs covered, right? Do you think it will work? After all, you took the HBM by the book and plugged it right into your program components. Suppose you follow up 3 months later and find out that not one of the musicians has quit or even tried. Most of your pamphlets, flyers, and other information have been tossed or not used. Barely a handful of people came to the demonstrations. What incarnation?
You just succumbed to the easy program structure illusion. The key to avoiding the easy program structure illusion is to first do some research and then target your program and the theory to the people you're trying to help. Second, don't think of the theory as the complete story. It's a tool, a guideline, and a framework to help you develop an effective program. Let's redo this using the same participants. What would you do differently? Focus group interviews with musicians, cost benefit, no insurance, priority is getting a gig, no time to take off to attend a class for a month, and social benefits. Justin, can you read the next one?
Sure.
Next 2.
Okay. The HBM in action, part 2. The focus of your perceived severity. Themes shift from the disease consequences of smoking to the potential cost of losing future gigs and careers. Maybe you have a tagline that says, got throat cancer, can't get gigs, got lung cancer, can't get gigs. Or Charles is a blues man. He smoked 3 packs a day. Now his only audience is a couple of nurses. That stinks. To demonstrate that the costs of quitting are relatively low, this time you focus on quit smoking modalities that the blues musician could really use, like the nicotine replacement patch, which is easily available at local grocery stores and pharmacies and doesn't take critical time away from performing.
Cassie, do you want to read the next ones?
Right. that say mammogram?
Yes.
Okay. Okay, mammogram screening intervention. In Maryland, outstretched individuals have been unsuccessful in engaging low-income African American women in mammogram screenings. Using the HBM, a cultural targeting intervention was implemented to promote a non-cost mammogram screening program. Data was collected from women 40 years and older on their history of mammograph use and the knowledge and beliefs about breast cancer. A 50% screening rate was achieved among 119 eligible participants. Significant reductions of screening behaviors were perceived barriers, lacked of and limited knowledge. The HBM primarily focused on individual decisions and does not address social and environmental factors necessary. Calculations will vary based on the kind of information and interpretations being made. The HBM assumes that everyone has equal access to and an equal level of information from which to make a rational calculation. Does not account from
Disparities.
Thank you, and in knowledge. Age factors, too young or too old, do not care. Recognizing barriers. The health belief model, the end.
Okay, it says to summarize how the health belief model works now. So I think the summary is that you have to make people want to go and have the screening or whatever because they might feel at risk, or some other factors, like maybe when it comes to like breast cancer, if they have a family history of it, they would be more willing to go in and have a mammogram or something like that. Or like in the reading this week with the TB cases, if they're in a high risk area that, a lot of people are having TB.
Yeah, I think also like seeing like how it'll affect your life instead of like with the smoking one. It's like everybody knows smoking's bad for you, but then it talked about how like putting out there like so-and-so smoked and now his only audience is the nurses, or and saying how like it will really affect your lifestyle if you keep doing this, or how like not getting a mammogram screening will personally affect you.
Right.
Yeah, I think the thing to remember with it too is the HBM model is just a framework for how you can conduct an intervention, but it's not gonna work. Like one intervention is not gonna affect a certain group in the same way it would another. So like it doesn't take away from the fact that you really need to get to know your target group and figure out how it's gonna best work to change.
Right. So yeah, I agree with you. I think before anything, you need to go in and get to know your target population.
Mm-hmm.
And that way you can, when you set up your model for education, you'll know the best method to target them and to do outreach, so they'll be more willing to go in and like either change their habits or be screened or whatever, with that.
Yeah. I read somewhere that it's a psychological model. And I like that because it tries to explain and predict health behaviors by making the person understand the change or what will it take for them for a related health action to take.
I agree. I mean, because no matter what, unless a person has the desire to be screened or change their behavior, it's not going to change. So you need to find out what would make them want to change. It says, what kind of interventions centered on the process move people through the stages. And it says discuss the process and how they relate to the stages of the model. Does anybody have any kind of ideas on that?
Can you read that again?
Yeah.
I read through this and I was kind of confused at that part.
Yeah, me too. It says discuss the process and how they relate to the stages of the model. And then it says what kind of interventions centered on the process move people through the stages.
What process is it talking about?
I don't know.
Like changing, and we're talking about the health belief model, but other than that,
I would just say, like, reading the PowerPoint, it said that at first the people like threw the brochures and stuff away. So I would say you need to first, get the information to get to know your target group before you even put any information out, because otherwise it's kind of like a waste of your time and your and costs.
Yeah, that's really true. And it sounds like they maybe even spent more money in their first go around, like with all the brochures and whatever else, like the classes and stuff, and then they didn't work.
Well, and I think also too, like knowing your population, part of it is like knowing the age group for the population that you're going to try to educate. Because like if it's somebody that's older, you aren't going to necessarily want to send them electronic communication, because a lot of older people are not very savvy with that. And but if it's someone younger, you could do a Snapchat or a text or something like that, or a YouTube, and they would be more apt to look at it than a brochure.
Right. Yeah. Can you read? I know, like, you might have to switch gears a little bit, but I'm thinking about this question. But could you read those 8 different types again for the intervention?
Yeah. So according to the intervention table from lesson 3, the interventions are health communication strategies, and I'll give you an example of each one of these so we kind of know.
Okay.
This kind of example is one-on-one communication, small group communication, social media, or interactive media. Let's see, it says using posts to think strategically about social media. Post is defined as people and objectives, strategy, and technology. So that's intervention number 1.
I feel like we could apply that to like perceived susceptibility, like by using one-on-one communication, or even through the media, like you said. You could help someone to understand like that they are susceptible to an issue.
Right, I agree with that. Like if you want to talk about like vaccinations, I mean, usually the target population for this would be like parents and small children. So and what their susceptibility is like when they start school or they're unprotected, they could get whatever illness they haven't been vaccinated for.
Yeah, I think you had a good point too of like using Snapchat. Like, you could create some kind of ad-on Snapchat that reaches like teenagers, because now they're still under their parents' care, but they're more cognitive, and so I feel like they could recognize the importance of vaccines and then talk to their parents about it, like ask about it to get more information and kind of give their own opinions to their parents, because even though they're teenagers, like they still have them and could sway their parents a little bit more too.
Right, and that way it might influence the parents. That way, if the kids are asking about it, and get the vaccination for it.
One thing that was just kind of like reminding me of is just like an example I've seen is on like a lot of like older Disney movies. Like we just bought Peter Pan, and on the previews, there's one where it's like smoking is really bad, and it doesn't just affect you, and it it affects everyone around you. And la la la. I thought that was kind of interesting how they put that on like a child's movie, and like even though like the parent might be in there watching the movie with the kid, it's like the kid's still like, "Mom, what's this? It's saying it's bad," Kind of.
I've never seen that before. That's interesting. Do you guys want me to go through the rest of them?
Yeah, and maybe like if anybody has thoughts, we could just talk about it like with the constructs, because maybe that's kind of what it's asking. I'm not really sure.
Yeah, me neither. So the second one is health educational strategies, which the example is classroom settings, seminars, workshops, face-to-face teaching and online. Material must gain attention, present stimulus, material, and tailor message to knowledge and values. Demonstrate observable effectiveness, which makes desired behaviors easy to understand. Provide guidance, elicit performance, and provide feedback. Enhance retention and transfer. So I kind of think the first two on here go hand in hand. I mean, and it could be with the health belief model 1 and 2. Using this, you could demonstrate the perceived susceptibility and also the perceived severity of the illness that we're trying to educate the population on. Like, just like with a newer one is like the chickenpox vaccination. Staying with vaccinations, that you know, if you get the chickenpox, you know, it does horrible things to you, but if you have the vaccination, even if you do get the chickenpox, it's not going to be as severe as it would be if you would just have them.
Yeah, something that from what you just read, like of those descriptions, it reminded me. In high school, we had this program called Every 10 Seconds that they would do like every year, and it was about drunk driving. Like every 10 seconds, somebody dies from a drunk driving related incident. So obviously, like it affects the drunk driver, but it affects more than that, and so that's like what they were trying to get at. But it was cool because our student body president made a video that like seemed really real. Like they went to like the hospital and acted out this whole thing and had kids, and everybody knew and
Did
cared.
they have like do they have like the car wreck set out outside?
Yeah. Mm-hmm. And so it was just neat because they were able to get everybody's attention and explain that you're all susceptible to this kind of accident when there are so many kids doing it, and the severity of it can be really bad. And they showed both of those things. And then throughout the day, they had already chosen kids that couldn't talk the rest of the day because they had, you know, been a victim of the crash. So every 10 seconds, a new kid like was gone. Like not really, but they just acted that way. So it's just like interesting. There's such a wide variety of things you could do depending on the health issue and like the target group.
Well, and I think too, using that, I mean, now, like, because I live in California and marijuana is legalized here, and I think they need to like expand that even more in the future, and include like marijuana use and vaping and all that other stuff that are going to be coming out as, you know, more health issues here in California.
Like you want them to legalize like the vaping or what?
No, they already legalized marijuana here. I think the age limit, I think it might be 21 still, but you know, just like drinking, kids are going to be doing it more frequently since you can like just go to a store and buy it. Yeah. And it's not illegal. So I'm thinking like in the future, they're going to have a program like they do. They call it the every 15 minutes program for the drunk driving here in California. But they're going to have more programs like that so kids know the side effects and, you know, the things that can happen when you smoke marijuana or vape.
Yeah, that's crazy. And it's like interesting that you can already see an issue with it in the future.
Yeah.
It's interesting how once something becomes legal, you know, before it's illegal, so they feel, oh, it's bad, we shouldn't do it, and there's some people obviously that are like, oh, it's okay, you can, you know, it's fine. But now that it's legal, I'm seeing and hearing more and more people debating, oh, well, it's legal now, so it's okay, right? Even I've seen members of the church starting to say, well, I have issues, and you know, I think it would help me, and I don't know. So I'm seeing more people rationalize it because it's legal. I can do it, right? And then I I go back to telling people, well, the church has rules and they say, oh, well, we can't drink alcohol, and yet alcohol is legal. So what's the difference, Because it's legal doesn't make it right.
I was gonna say, one of my girlfriends, her like uncle's a stake president, and he said that like it's to be kept like really low key, but that if like you have like a prescription for medical marijuana, like it's okay in the church, but they're not like making like a public announcement because it's saying like, oh, you can go out and smoke, marijuana and stuff. But so it's kind of interesting too, just to see how.
Yeah, no, I feel like if it has a prescription, then yeah, I mean there's a lot of things that we take prescriptions on. For example, even opiates. Like our doctor will give us prescription for Vicodin, right? Stuff like that. It can be extremely addicting, but if it's for the right reason, then yeah, I mean, I think it's right. But then if you use it without prescription, you use it, for a different reason, for a reason that's not appropriate or recreationally, then you're going to become addicted, or you're going, it's just not right.
No, and you know what? When I went in for my temple interview back in December, my bishop asked, like when he came to the point where he's like, "Are you using like any harmful or addicting substances?" And he's like, and then I'm also going to add on there, are you using like any prescription medications or any painkillers in ways that aren't supposed to be used too? I mean, that wasn't, like out of the recommend questions, but he's like, I'm just going to add that on because people will be like, oh, I'm good, except I take, like I'm taking oxycodone on the side, and they don't count it because it's not like coffee, tea, or alcohol.
Yeah.
Well, and then also I think people think if a doctor prescribes it, then it's legitimate, but I think everything, even like with the word of wisdom, everything needs to be in moderation.
Yeah, the doctor I work for back in Rexburg, they had to, I don't know if it was like a national thing or the hospital or whatever that he works through, but they put a different ban like on narcotics, so like the pharmacies won't, like they can fill it once or twice, but like for the people who are like drug seeking patients, they can't get it filled more than that.
I know, like my dad, when he was in his 20s, he broke his back and he has chronic pain. He's gone to pain clinics and stuff, but my dad has been taking Vicodin since he was in his late 20s. And I mean, I know he's addicted and I know he has pain. And, people like that, I can understand taking it because they need it for their pain, but it is an addiction. And he's gone through a lot of different treatments and stuff to try to have other ways to relieve his pain, but they don't work as well as like Vicodin. So, I mean, there has to be a balance, and hopefully in the future, they'll be able to help people, whether it be with like some kind of nerve testing or stuff goes as far as pain goes.
Yeah, it's sad that it's come to that point, but I think it's like that in a lot of different situations. Like for my sociology class, we were talking about crimes and how there's like crimes of deviance or whatever, but it's like interesting how some people need it. Like did you say it was your father or father-in-law?
Yeah, my dad.
Yeah. So like he'd be one who like needs it, and then there's somebody else who really just has an addiction. Like how do you tell the difference?
Right.
That's rough.
So well, staying on this and still talking about like the behavior model, do you want me to, I'll go through the rest of them when we can talk about them, and then we need to talk about the scenario for the underage youth and tattoos.
Okay, maybe we can sorry.
So the next one is health policy enforcement strategies, and it's my example on here is about seatbelts. So I said the usage of safety belt, motorcycle helmets, bike helmets, etc., paying taxes for certain activities. Maybe I should read what the explanation was. Strategies include executive orders, laws, ordinances, judicial decisions, policies, regulations. So that's the enforcement type. And the example for me was it's illegal here to not wear a seatbelt or a bike helmet for kids under 16. I don't know what the law is there. I mean, everybody has to wear a safety belt here, but as far as bike helmets and stuff. So I guess we kind of went over that with the legalization of marijuana in California. I kind of think we covered that one, don't you guys think?
Yeah.
Mm-hmm. Yeah.
Okay, so the next one is environmental changes or environmental change strategies. My example is financial costs, affordability, accessibility to healthcare or patient education, social support, peer support, traditions of ethnic groups, emotional learning environment, and support for healthy environment. So using that, I think it's part of the determining the population, what would work for them, like different cultures or groups. And you probably know this from your sociology class you're just talking about. You know, you would need to educate them in the different methods to get them to want to change their behavior.
Mm-hmm.
Does anybody else have any kind of thought about that, or do you want to move to the next one?
Let's move to the next one.
Okay. Health-related community service strategies, community mobilization strategies, offering low-cost flu shots or child immunization, providing clinics, screening for diabetes, blood pressure, or cholesterol, providing professional health checkups and examinations, creating more support, keeping more people informed, and influencing decisions. So I think, I mean, there's a lot of different programs for people with low economics. So, I mean, part of that would be for this one is to try going back to knowing your target population, the demographics, and, you know, determining whether they could afford to pay for shots and different stuff, or whether or not they wouldn't do it because they don't have the means to pay for it. And the next one is behavior modification activities. I did this one. My example is kind of back to what we did when we interviewed people. If they want to change their behavior, one way they could do it was to have an exercise log, food log, journal, etc. Health screening can be blood pressure, breast examination, cholesterol checks, etc. So behavior modification is, a lot of it is people don't realize that they're doing a certain behavior until they start like writing it down or tracking it.
Mm-hmm.
Yeah, I actually used this. Was it this class that we did that in? Where we had to, for 2 weeks, write in a journal? I don't think so. Might have been
No, I
different.
wasn't this class.
Okay, there's another class then. I get this class and another class confused all the time. But we had to write basically journals every day for 2 weeks on something that we were trying to give up, like an addiction of some sort. And so I decided I was going to give up Facebook for 2 weeks. And it was really hard, and I ended up failing multiple times. And I realized, oh man, I'm actually really addicted to this. I didn't even know it. And it was taking up too much time. I realized I'd go on it for like a few minutes, when I had downtime or whatever. And I'm like, wow, I could be doing other things like reading the scriptures on my phone. And what was funny is after the 2 weeks was up, I wrote about that and I said, you know what, I could be doing better things with my time. And then the prophet actually spoke at some kind of youth fireside or something. And he invited not just the youth, but all the members of the church to stay off social media as much as necessary because of the negative content that's on it. And it takes up a lot of your time. And it's the exact same reasons why I said, and I just thought that was interesting that he would say that. Even things like that can be addicting. But my point is, the journals helped me realize that that it wasn't maybe the right thing for me to do personally, because it was kind of addicting and there was a lot of negativity on Facebook or social media. So I don't know.
I agree with you. I think, I mean, I know I pick up my phone all the time, And I don't think until you write something down, you realize how many times like you use look at your cell phone, or how many times you eat whatever bad food for you, or, you know, I think that once you write it down, it makes you more accountable and realize how many times you do something.
Yeah, I think it's interesting too that you pointed out, because I think we like can point fingers all the time and say, you know, like we have the narcotics addictions and the drunk driving and the nicotine, but like we all have addictions that we could go through some kind of intervention to help too. I mean, they're everywhere.
It's true. Let's see, let's move to the next one. It's organizational cultural activities. And I said, for my example, changing the type of food in vending machines, offering discounts for healthy food in the office, cafeteria, moving tobacco products behind the counter, allowing longer breaks or lunch for exercise. So I was kind of back on the example using for healthy eating. But I know, like at my work, if you go downstairs to the vending machine because you want a little snack, all of it is junk food. So if, you know, they provided healthier options, at least you'd have a choice to make a healthy choice.
Kind of like they used to have them on campus at BYUI, like in the art center, I want to say. They're like a vending machine where it had like deviled eggs or hard-boiled eggs in it, and you could, I don't know, I can't even remember. It was like a protein shake type of thing, like apples and bananas, like in the vending machines.
Mm-hmm. Yeah, because that way you don't have to, you know, eat a candy bar or something. You can eat an apple.
I work at the University of California, Irvine, and they have really healthy food, like at the I guess it's like a little cafeteria, but it's really expensive. And so I end up never even going there, because I'm not going to spend $7 on a little salad or something like that. Like, that's ridiculous. So I think that not just providing like extra time for lunch or whatever or just healthy things as well, but making it cheap, affordable for people to be able to buy it.
I agree with that, because yesterday I actually went to Costco and ate at their food court, and a big slice of pizza was $2, but a salad was like $4. So of course I picked the pizza because I didn't want to spend the extra money.
Yeah, there was a class. I don't know if it was this one or last semester, but they were talking about lunch at schools, and they were talking about kids with obesity, and they were saying that it mattered a lot, like what they did at home, like what they ate, so what the parents bought for them. But then once they were at school, like the options were not as healthy. Like on Monday they had Arby's, on Tuesday they got Chick-fil-A, on Wednesday they had Burger King, and they had like all these fast food options. And they didn't really have like any healthy food. So the efforts they were doing at home, like we're making at home, or all the progress they were making, like it was being like defeated by the food they were consuming at school, because it was not like aligned. So that was really interesting too.
Well, there used to be this program on TV. It was with Jamie Oliver, and he would go to different cafeterias to see how they made their food, and it seemed like almost all of the cafeterias made unhealthy food. Like they would say a vegetable was like French fries instead of like a real vegetable. So
yes,
you're right, when it comes to that, it's like there's nothing healthy for the kids to eat.
They were trying to justify the pizza, saying that it had vegetables in it because of the tomato sauce.
Oh my gosh.
Wow.
And so that's why they kept it, because it's a vegetable and it's healthy, apparently.
Oh my gosh. Yeah, no wonder the obesity is so high.
I guess they don't realize that when you cook it, all of the nutrients are like cooked out of it or whatever, or I don't know.
Yeah. I'll go over the next one. I think there's this is the last one, social activities, and I said the definition is the importance of social support for behavior change and its relationship to health. Many people find it easier to change their behavior, and they are more successful if they have support from a spouse, friend, family member, or coworker. So my example was having a partner for the gym, weight loss, and healthy eating. AA and other support groups have been very successful with the support group or buddy system method.
I think that help or goes along with.
So that's all the intervention table interventions. And let's just kind of move to the scenario discussion. So I'll read the following quote. Herein, parental influences compete and often conflict. As youth approach early adulthood, they decide upon ways they wish to present themselves to others and count the costs of doing so by gauging the reactions they get. Attendant to this process as psychosocial risks and rewards. For example, the choice between acceptance by peers and rejection by parents and other authority figures factor into the decision-making process for behavior in general. We imagine this to be a more consequential when individuals contemplate getting something as permanent as a tattoo. So it says, key discussion point, what is the behavior behind tattooing? One thing I can talk about tattooing up front is one of my friends was just diagnosed with breast cancer, and she had a lumpectomy and had her gland, what are those called? Those glands that she had to have those removed. I can't remember what they're called. Her lymph nodes, that's what it was. And I mean, fortunately for her, it came back, her lymph nodes were clear, but what I found interesting is she said that her lymph nodes were black, and her doctor told her the reason why they were black is because she had gotten tattoos and all the ink went into her lymph nodes.
Wow.
And I had never ever heard that before. And tattoos are way more common now than they used to be. It seems like almost everybody has one that no. I mean, well, maybe not you guys, but like if you're a member of the church, some people have tattoos and most people don't. But for the general population, it's more popular than it had been before. And so I think kids that are younger are thinking, my parent has a tattoo, or this cool skater or whatever has a tattoo, and I want to be cool, so I'm going to get a tattoo also. Not thinking, and not thinking about, the fact that, the ink could go to your lymph nodes. How does that affect your body? Not thinking about, is the needle a clean needle that they're using, or has it been used on someone else? Or the fact that when they get older, the colors will fade, or their skin will sag, and it won't look as attractive as it does now.
Which is really probably what the teenage population would care more about at the time. Is like the looks, because that's why they're getting them now anyways.
Right. And, and whatever they have, the ink on their body, unless you buy the ink that's easier to remove with laser, that's something it's going to be permanently on your skin forever. And the skull that you have on your skin now might not be something that you want to have on your skin in 10 years when you're trying to get a professional job.
Right. I have a friend who, she was unfortunately put into like a bad situation. Something happened, and so she ended up getting like a tattoo right here. And now, like 5 years later, she's now married and has a little baby, and she was raped, which is why she got the tattoo. And she's like, why did I do this? Because now every time I look at my arm, that's kind of what I think of. So she's been going through the process of getting it removed, and it's like 7 or 8 treatments, and she like has posted things on it where you can like see just like how it almost looks like her skin is like burnt from where they did the tattoo removal.
Ew.
Too, yeah.
Yeah, someone was telling me it's way more painful to get a tattoo removed than to get one put on.
Yeah, I heard that too.
I feel like sometimes too, like people do it. Like you guys were talking about how, oh, like my mom has a tattoo, so I can get a tattoo, like not a big deal. But I feel like sometimes, like when I was up at school and living up in Rexburg, I had roommates who were like, well, let's go get ear piercings or let's go get tattoos because like we're not supposed to, and just kind of wanted to like rebel against that. And so I had one roommate who seriously got like 4 tattoos in one semester.
Oh,
Wow. Well, that's expensive besides painful.
yeah. Financially and physically painful.
Yes. Let's see. Well, we kind of talked already about what the behavior was behind tattooing. I think that's the only thing we needed to discuss with this.
Yes.
And so I don't think we need to come up with any kind of, do we have to, on the assignment, do we have to discuss anything about that? I guess we do.
I think it's just like a prep for to filling out the table.
Right.
Yeah.
Well, I have a question.
We each save our own copy, I guess.
Right. I wish we could, when we're doing this, we could all just go in Google Docs and kind of work on it together. I think that's going to be my recommendation for the other classes. If we're going to meet, it would be so much more helpful if we could just like fill it out together.
Well, maybe we could, I don't know, and then just save it ourselves. I don't know.
Well, it said on the directions that we're supposed to fill it out ourselves.
Okay.
Is that for the application assignment or?
Yeah, the application assignment.
I have a question. So, are we? You know how we were just talking about the tattoo?
I can't really hear you.
I can hear
Sorry. Can you hear me now?
Okay.
Can you hear me?
I can hear you now.
Okay, sorry. So for the health belief model application to the health issue portion, like for the table on the application assignment, is the issue that we're supposed to be talking about the tattooing issue? Like
I believe it doesn't, let's see. Oh yeah, it does say, it says instructions, follow the steps by applying the health belief model with adolescents at risk of the likelihood of being tattooed, interested in tattoos, or obtaining another tattoo. Type your answers directly into this worksheet.
Oh, okay.
So, I mean, the first one is just the overview of the health model, kind of like what we did earlier. We just need to write that in there in paragraph format. But I think for number 2, it says health belief model application to the health issue, and then it says complete the table below.
Yeah.
And it says, what individual interventions, with the S in parentheses, are you developing to apply the constructs as a health educator? And then it says from the 8 different types. My question on this was, are we supposed to only pick 1 or 2 of them, or are we supposed to go through through all of them? Because looking at the table, it really only leaves room for 1.
Yeah.
Do you guys think we're only supposed to pick 1?
Room for 1.
I can see your lips moving, Casey, but I can't hear you.
Hold on. Can you hear me now?
Yeah.
I was like wondering why you were ignoring me earlier, but that makes a lot more sense. So what do you mean though it only leaves room for 1? Because I see a lot of different tables or a lot of different slots for the intervention type.
Oh, we'll see. I just printed it and it just looks like there's 1.
Oh yeah, but maybe do you think like, you know how it says like perceived susceptibility and it has its own line?
Uh-huh.
Like you would do a different intervention for each thing, or?
I guess we could. I'm not sure.
Yeah.
I didn't know if we picked 1 and then we were supposed to outline what we thought the benefits of using that 1 was, or I wasn't sure.
I think we pick 1 intervention per each construct, right?
Okay, yeah. That would make
Right.
sense.
I would think so. I don't know.
The 8 different types. It's so you can look in the intervention boxes. It says what individual interventions. Oh, but then it has an S.
Right.
So maybe you could have more than 1. Are you developing to apply the construct as a health educator. So maybe we can pick more than one.
Well, and it doesn't even really leave, except for if you put a bullet under intervention boxes, which one you're going to even use. So it's not like when it has intervention, are you just supposed to put like perceived susceptibility and put what intervention it is in that field?
Well, what intervention you're going to use applied to that construct and how it will help them and what the impact they'll have on them.
So then you would put what intervention and then the description, what you would use, and then the expected impact.
Yeah, the description is what the intervention is going to do.
Okay.
So I think you are supposed to try to use different ones. Like, I think you could probably use the same one for a couple of different ones, but it probably would make sense to use other ones. Probably just want to see like our knowledge on all of them.
Right. How long have we been recording? Do we have time to go through them?
We could be done though too. Let me pause it real quick.
Really?
I'm gonna pause it.
I unpaused it. It doesn't count. Because we're supposed to meet. Can you hear me? Can you guys hear me?
Yes.
Okay, sorry. So we're supposed to meet between 45 minutes and an hour, right?
Yes.
And I think we definitely hit the 45-minute mark.
I think we started at like 5 after, so I think we're at like 55 minutes-ish.
Okay.
Do you guys, it says for us to submit our own, but maybe if we posted this document on Google Docs, we could maybe each take one and make our life easier.
Kind of worked.
Yeah.
Yeah, I know how to post in Google Docs.
Do you mind posting this document on there, and then maybe we can decide who takes what slot, and then we can work on it during the day?
Yeah, that sounds good. Should we talk about who's... Okay, wait. I'm going to stop the recording now.
Oh, wait. Let's talk about who's going to be the leader next week.
Oh, right.
Okay, yeah.
Does anybody want to volunteer, or do you want me just to pick someone?
It doesn't matter.
I almost volunteered and I was like,
All right. Justin volunteered. It's Justin.
Yeah.
Oh, great. All right.
Okay, perfect. Okay, stop recording.